Hi, this is Dr. Sherry Shabowski at Medical Education in Minutes, and this is another classic clinical presentation. Today, we are going to meet Paula Nefreedis. Meet Paula and Ben Nefreedis. Paula and Ben have been married for 2 years, and they are trying to have a baby. After their intimate encounter, they fall asleep, hopeful that she will become pregnant. In the morning, Paula, a 32-year-old healthy female, goes to the bathroom. And when she urinates, it burns quite a bit at the end. She doesn't think too much of it and goes about her day. Throughout the day, she finds herself running back and forth to the bathroom very frequently because she feels like she really needs to pee. But when she sits down, she only pees a few drops. But those drops really burn. She goes back to what she's doing, and 10 minutes later, she feels the urgent need to go again. By the evening, she is not feeling well at all. She has a fever and shaking chills. The next morning, she feels even worse, and now she starts to vomit. She decides it's time to go to the doctor. When she gets to the doctor, she tells him everything that has happened. He evaluates her and finds that she has a fever of 102.7 and she is tachycardic at 110. On exam, she has left costovertebral angle tenderness and a vague discomfort with palpation of the suprapubic area. Her white blood cell count is elevated at 22,000 and she has pyuria, which means a lot of white cells in the urine, and bacteriuria. That's bacteria in the urine. It is not a great surprise that there are a few red blood cells related to the inflammation. The pregnancy test, importantly, is negative at this time. The doctor says it appears that you have acute pyelonephritis. That is a kidney infection. As you may know, urine begins as an ultrafiltrate of blood that is processed in the kidneys and then passes into the muscular ureters, where peristalsis pushes the urine into the bladder. The bladder is the holding tank that keeps the urine until it's time to urinate through the urethra. For women, the urethra, vagina, and rectum are in close proximity to each other. During sexual intercourse, there is typically some agitation in the area. This may allow the local bacteria from the vagina and or the rectum to come in contact with the urethra. Urine has the ability to flush bacteria out of the urethra. But if you have sex and then sleep through the night, it gives the bacteria the opportunity to adhere and ascend through the 1-inch long urethra, invading the endothelium, and then ultimately setting up shop in the bladder, where they adhere, colonize, and multiply. The bacteria draws the immune system, which leads to local inflammation. Inflammation in the urethra causes the sense of urgency that makes you feel like you have to run to the bathroom very frequently. It also makes it burn when only those few drops come out. Once the bladder becomes inflamed, it causes a lower abdominal ache and pulling sensation with urination. Some types of bacteria are very aggressive and will continue to ascend the urinary tract up the ureter, typically only on one side, ultimately winding up in the kidney. In the kidney, it causes a soft tissue infection with more inflammation. The inflammatory mediators are absorbed in the very vascular kidney, causing fever rigors, which are violent chills, and often vomiting. If not treated properly, the bacteria can back up into the blood, causing bacteremia and possibly sepsis, which could be life-threatening in certain circumstances. Acute pyelonephritis requires antibiotics, which will typically resolve the infection. It can often be given by mouth, but since you are vomiting and ill, we will give you the first dose IV. Urinating after sex can go a long way to protect you from having this problem in the future. I know you said that you are trying to get pregnant. Urinary tract infections can be threatening to the pregnancy, and you are much more likely to get a kidney infection if you have one. The uterus puts pressure on the bladder, causing back pressure toward the ureters. Increased progesterone levels cause the relaxation of the ureteral muscles, which make bacterial passage to the kidney much easier. So when you're pregnant, you're going to have to be very careful. If any of those things occur, especially if you have symptoms like you're getting another urinary tract infection during pregnancy, please come back very quickly. The doctor ordered the dose of antibiotics IV. All of a sudden, after the antibiotic dose was almost done, she started to feel a bit woozy. She pressed the call button to get the nurse. The nurse found the patient complaining of dizziness. Her breathing was normal. She had no skin rash. Her heart rate was 98, but her blood pressure had gone down to 70/40. The nurse laid her flat, and she felt much better. The nurse also put up a liter of IV fluid. After about an hour, her blood pressure slowly returned to normal. She did not have any further symptoms. In fact, she felt much better. What happened? Well, urinary tract infections are most frequently caused by gram-negative bacteria that are often armed with endotoxin within their cell wall. When the antibiotic lyses the bacteria, the lipopolysaccharide endotoxin within the cell wall is released into the blood. This may cause a severe inflammatory response or sepsis. But in healthy young women, we often see a transient event of nearly asymptomatic hypotension corresponding with bacterial lysis. It is important to note that hypotension in the face of an infection can be a very serious finding, as it may suggest that you are moving toward overwhelming sepsis. But there are a handful of patients, usually healthy young women, that become transiently hypotensive after antibiotics. But their hypotension usually resolves in about an hour. IV fluid has little effect, and typically the patients feel just fine. The rate of administration of the antibiotic may have an effect, meaning that if it's given too quickly, this is a little more likely to occur. If this does happen, it is critical to reevaluate the patient and monitor for signs of sepsis. But if the symptoms resolve and the patient's vital signs normalize and they feel well, they may be discharged a few hours after a few hours of observation. But if there's any question that the patient is not better or worse in any way, they absolutely need to be admitted to the hospital. The doctor comes back to see the patient a couple hours later. She is feeling better than when she even came in. She's had no vomiting, her vital signs have improved, and her lactate is normal at 1.2. The doctor explains that the transient hypotension sometimes comes from the bacteria being killed by the antibiotics, and it is more likely to occur if the antibiotics are given too quickly. He says, "Luckily, you look great, so we will still be able to send you home. We believe this is okay because you do look great, and your signs and symptoms are much improved. But if your symptoms recur or you feel unwell in any way, or if you're unable to take your antibiotics, then you'll need to return immediately to the hospital and we'll admit you and watch you for a couple days while you get IV antibiotics. Paula says, "Okay, sounds good, doctor." And the doctor reminds her, "Don't forget, always urinate after sex." 2 months later, she checks in and thanks her doctor. She is feeling great and just found out that she is pregnant. Thank you for learning with me today. I really appreciate it. If you are interested, there is full course content at www.medicaleeducationinminutes.com. Okay, see you next time.